Hello and welcome. Today we'll be diving deep into a complex and potentially life-threatening condition called tumor lysis syndrome, or TLS. We'll explore what it is, what causes it, how it affects the body, and how we can treat and prevent it. Get ready to learn about this critical oncologic emergency. So what exactly causes tumor lysis syndrome? The primary culprit is the rapid breakdown of cancer cells. This breakdown is often triggered by cancer treatments such as chemotherapy, radiation therapy, or targeted therapies. However, it can sometimes occur spontaneously, especially in cancers with a high tumor burden and rapid cell turnover rates, like Burkitt's lymphoma or acute leukemia. The faster the cancer cells die and release their contents, the greater the risk of developing TLS. Now let's understand the pathophysiology. The rapid destruction of tumor cells releases large quantities of intracellular components into the bloodstream. These include uric acid, potassium, and phosphate. The excess uric acid can crystallize in the kidneys, leading to kidney damage and acute kidney injury. High levels of potassium, known as hyperkalemia, can disrupt heart function and lead to life-threatening arrhythmias. Elevated phosphate levels, or hyperphosphatemia, can bind with calcium, causing hypocalcemia, which further exacerbates cardiac and neurological problems. All these metabolic derangements, if left untreated, can overwhelm the kidney's ability to filter the blood, resulting in kidney failure and potentially death. TLS isn't equally likely to affect everyone with cancer. It is most commonly seen in patients with hematologic malignancies, particularly those with high tumor burdens such as acute leukemia, Burkitt's lymphoma, and diffuse large B-cell lymphoma. Patients with chronic myeloproliferative disorders can also be at risk. While less common, TLS can occur in patients with solid tumors, especially those that are highly sensitive to treatment or have a large tumor mass. Factors like pre-existing kidney disease, dehydration, and the type and intensity of cancer treatment also influence the risk. The signs and symptoms of tumor lysis syndrome can vary depending on the severity and the specific electrolyte imbalances. Some patients may experience nausea, vomiting, diarrhea, and loss of appetite. Muscle cramps and weakness are common due to electrolyte disturbances. More severe symptoms include heart arrhythmias, seizures, and even sudden death due to hyperkalemia. Kidney failure can manifest as decreased urine output, swelling in the legs and ankles, and fatigue. It's crucial to recognize these symptoms early to initiate prompt and appropriate treatment. Diagnosing tumor lysis syndrome involves a combination of clinical assessment and laboratory tests. Doctors will carefully evaluate the patient's medical history, cancer type, and treatment regimen. Blood tests are crucial to measure the levels of uric acid, potassium phosphate, calcium, and creatinine. An increase in uric acid, potassium, and phosphate, along with a decrease in calcium and an increase in creatinine, strongly suggests TLS. Electrocardiograms, or ECGs, may be performed to monitor heart function. Urine analysis can also help assess kidney function and detect uric acid crystals. While we don't typically classify tumor lysis syndrome into types, it's important to understand the severity of the condition. The Caro-Bishop definition is often used, which categorizes TLS either laboratory TLS meeting laboratory criteria for electrolyte abnormalities, or clinical TLS, a laboratory TLS with clinical manifestations such as kidney injury, arrhythmias, or seizures. The severity of the electrolyte abnormalities and the presence of clinical symptoms guide treatment decisions. The cornerstones of treating tumor lysis syndrome are managing the electrolyte imbalances and preventing kidney damage. Intravenous fluids are administered to increase urine output and flush out excess uric acid. Medications like allopurinol or rasburicase are used to lower uric acid levels. Allopurinol inhibits uric acid production, while rasburicase breaks down existing uric acid. Electrolyte imbalances are carefully corrected through medications like calcium gluconate for hypocalcemia and potassium binders for hyperkalemia. In severe cases, dialysis may be necessary to remove excess electrolytes and waste products from the blood. Prevention is key in managing tumor lysis syndrome, especially in high-risk patients. This starts with identifying patients at risk before initiating cancer treatment. Hydration with intravenous fluids is crucial to maintain adequate urine output. Allopurinol or rasburicase may be administered prophylactically to prevent uric acid buildup. Closely monitoring electrolyte levels and kidney function is essential. Proactive interventions can significantly reduce the incidence and severity of TLS. The prognosis for patients with tumor lysis syndrome depends on the severity of the condition and the promptness of treatment. Early recognition and aggressive management can lead to a full recovery. However, if left untreated, TLS can result in kidney failure, cardiac arrest, and death. Recent research focuses on developing more effective strategies for prevention and treatment, including novel uric acid-lowering agents and improved dialysis techniques. Scientists are also exploring ways to predict and stratify patients at risk of developing TLS to personalize preventative measures. Thank you for joining us on this exploration of tumor lysis syndrome.